Stream the meeting. Okay. Stream the meeting. All right, it's live now. Okay, we can start by recitation of Kitab Al-Fatiha. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Ar-Rahmanir Rahim. Maliki Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Yes, please, if you want to continue. And this is the last one. It's going to be the most difficult among others. Okay, so be careful. Okay, you will be evaluated based on your performance, individual and also the group work. Okay, so make sure if I ask you something, then you are able to answer that question. She was taken to clinic kesihatan for health checkup due to irregular menstrual cycles. And upon history taking, the physician ordered hormonal blood tests. And the result for the test are as follows. Okay, you can continue.
Okay, Assalamualaikum. Today we will present PBL3 Trigger 2. Okay, for the FILA table, facts is experience irregular menstrual cycle, undergo hormonal blood test, free thyroxine 2.87 per deciliter, which is high than the normal range. The normal range is 0.9 to 2.3 nanogram per deciliter. Total 3 iodothyroxine 374 nanogram per deciliter, also higher than the normal range, which is 60 to 180 nanogram per deciliter. Thyroid stimulating hormone TSH less than 0.018 microunits per milliliter, lower than the normal, which is 0.5 to 5 microunits per milliliter. Thyroxine 18.2 micrograms per deciliter, higher than the normal, which is 5 to 12 micrograms per deciliter. And based on based on the symptoms and the test result, we conclude that Ayla is suffering from hyperthyroidism. Okay, for the learning outcomes are diagnostic tests for hyperthyroidism, pathophysiology of hyperthyroidism, treatment and management of hyperthyroidism, prevention, complication, and risk factor of hyperthyroidism, and Islamic perspective. For the action plan is to study the pathophysiology of hyperthyroidism, to learn the treatment and management of hyperthyroidism, to identify the diagnostic tests for hyperthyroidism, to discuss prevention, complication, and risk factor of hyperthyroidism, and to relate to Islamic perspective.
Why only one hyperthyroidism? You got any other ideas? What is happening to her?
No, based on the tests and based on the test result and all the other symptoms, we conclude that it is hyperthyroidism.
Why not hypothyroidism? Camelia.
Yes, doctor.
Why it's hyper?
Because the her heart rate is higher.
Heart rate higher is something to do with the heart. So it's tachycardic, increased heartbeat and heart rate. Oh. What does it need to do with the hypothyroidism?
Because there are it produces too much thyroid hormone.
Brilliant. Okay, so When you say about the hyperthyroidism, it refers to the hormone itself that is hyper. Yes? Yes, and if it's hyper, then it can affect the heart too. And what Camelia is saying also true. But it's the byproduct or it's the second event that occur. Okay, so it should start with the hyperthyroidism or what do we call it? Changes in terms of the level or the concentration of thyroid hormones, and that's going to lead to lots of other complications. It can affect the brain, it can affect the guts, it can affect the liver, it can affect the heart. All right, so you started with the endocrine system, so that is why we are giving you the second scenario where you can see the TSH, T3, T4, all of them is high. Okay, sorry, TSH is low, but T4, T3, and free thyroxine is high. And make sure you know why the TSH is low. Move on to the next slide.
For this slide, I will explain about diagnostic tests. For hyperthyroidism, we will use a blood test, which is we have three: thyroid stimulating hormone (TSH) test, thyroidothyronin test, or we call it T3 test, and the last one is thyroxine test, or we call it T4 test. Okay. TSH test is used to find out how well your thyroid is working. It can tell if we have hyperthyroidism or hypothyroidism in our blood. But a TSH test cannot show what is causing a thyroid problem. If the thyroid hormone levels in our blood are too low, our pituitary glands make larger amount of TSH to tell our thyroid to work harder. If our thyroid hormone level are too high, the pituitary glands make little or no TSH. By measuring TSH level in our blood, we can find out if our thyroid is making the right level of hormone. TSH test result can tell our if TSH test result can tell we if our thyroid is making too much or too little thyroid. But the test cannot explain why our TSH level may be too high or too low. If our test results are not normal, our provider or our doctor will probably order other thyroid blood tests to find out what is causing our thyroid problem. The next test we need to proceed is T3 test and T4 test. For the T3
Huda,
test, yes.
thanks to Google. Thanks to Google, tell me simply what is TSH and how does it get synthesized? What is TSH and how does it get into the system? Where does it come from? And what is the function? What is it to do with it? What is it to do with the T3 and T4? What is the relationship? Tell me.
Based on my understanding, kalau macam nak, if we want to know we get hyperthyroidism, first of all, we will do TSH test. Tapi TSH test ni, dia tak boleh bagi tahu kita apa yang menyebabkan kita boleh dapat thyroid. So we need to proceed to T3 test and T4 test based on my understanding lah.
Okay, so which one comes first?
TSH test.
TSH test, but it's not enough. So we need to confirm or validate with the T3 and T4 test.
Yes.
Okay, so my question is, where does it come from?
Where does it
come from? Yes.
Apa yang come from?
The TSH.
Thyroid?
Is
thyroid
it from the thyroid what?
Thyroid gland?
Thyroid gland. Atika, did you agree with Huda?
Is it TSH come from pituitary gland?
You ask me. I ask you.
Yeah. Maybe, okay, I agree.
You agree TSH come from the thyroid gland? Okay, I can see everyone's looking down on the computer or the mobile phone and looking for the answer. We'll see who one is the quickest one.
Pituitary glands?
Pituitary?
Glands.
Pituitary gland. Okay, so Camelia say pituitary gland. Atika say thyroid. Huda also say thyroid gland. Khalila, you can ask your cute. What is that bear at the behind? I think it's kitty kitten or something. Huh? What is it?
I think it's pituitary gland. I agree with Camelia.
You think, or is it Google thing for you? Okay, so it's the pituitary. Okay,
Yes.
so pituitary gland. Which side of the pituitary gland? How many portions?
Trio.
Yes.
Interior.
In Malay, anterior. What is it? Which one? In Malay. Anterior. Come on. You look. Why are you pointing at me, Fakia?
Depan, doktor.
Depan. Belakang?
Depan, doktor.
Okay.
Belakang?
Posterior.
Posterior.
Posterior. Okay, so most of the important hormones is produced by the anterior. Hence, if you look at the structure and the morphology or the anatomy of the pituitary gland, which one is bigger?
Anterior.
Anterior. So bigger means they have more roles. They can encompass or they can accommodate lots of hormones. That's why the structure, you can see it's bigger. So it's also play a main role in maintaining the endocrine system or your homeostasis. So you're saying that TSH is produced by the anterior pituitary gland. And how does this anterior pituitary gland know that it can secrete the TSH? Who tell? How does they get the information from?
Thalamus.
them?
Hypothalamus.
Okay, excellent. Hypothalamus. So hypothalamus functions to do what? What is the role of hypothalamus? We are discussing the system. Make sure you know the system, the tree of the system. We're going up now. So what is the role of hypothalamus?
Keep the body
nervous
stable.
Wait. One by one. Who wants? Atika. Okay, Atika. What do you say? Unmute. I cannot hear you.
Homeostasis, keep your body in a stable state.
Yes. I mean, the role of hypothalamus in this hormonal context. We know there are lots of other functions of hypothalamus, but you want to relate with the TSH, which pathways that they are following in order to secrete this TSH. Remember in my hormone class last time, hypothalamus functions to produce lots of what?
TRH.
Yes, very good. Lot of releasing hormones. Okay, we have lots of releasing hormones that is being secreted by hypothalamus. I don't want to talk about another functions or role of hypothalamus. As you mentioned, Atika, is for homeostasis. But we are discussing about the hormonal part. So from hypothalamus, it's producing thyroid? Releasing hormones, TRH. And what does TRH do? Nasratul.
Release TSH.
How does the hormone release its own hormone? TRH is hormone, and then you say that it's producing TSH. Is that right? What is the role of TRH?
Stimulate TSH.
How does it stimulate TSH?
Stimulate thyrotropin cell to release TSH.
Okay, almost there. Almost. Not 100% correct.
Maybe like TRH will triggers the pituitary gland, then the pituitary gland will stimulate the thyroid to release T3 and T4 hormone.
Excellent, 100 markah. Okay, so you know from hypothalamus, it's the endocrine gland. So endocrine gland can be pituitary gland, right? Anterior, posterior, and lots of other glands. For example, pancreas. So you have two things. You have the one that makes the hormone, and then you have the hormone itself that travels to stimulate another pituitary gland, okay, to stimulate another endocrine gland. So they act on the cell, Atika, you mentioned about the cell. So that's the gland. The gland ni, dia boleh hasilkan hormon. Bukan hormon TRH tu dia pergi bind kepada TSH, tak. TRH dihasilkan oleh hypothalamus, dia keluar, dan TRH ni dia akan pergi ke atas anterior pituitary gland, dia akan activate anterior pituitary gland untuk secrete TSH. Faham tak? Hypothalamus produce TRH. TRH pergi kepada anterior pituitary untuk secrete TSH. Faham tak? Sampai situ. Alright. So the hormone cannot act on the same hormone or the same or the other hormone. They must act on the gland, specific gland. For example, pancreas producing what? Insulin and glucagon. The beta cell of the pancreas producing insulin. Udah? Okay, don't look up. Alpha cell producing glucagon. Both of these, insulin and glucagon, are hormones. They are part of the endocrine gland. And insulin, once it's been secreted, it will act on the, on what? Where does insulin go? You have pancreas or not? And what's the functions of your pancreas? Nabila, you got two pancreas.
Yes.
What is the function of your pancreas?
Secrete the insulin and glucagon.
And after that, what happened to the insulin? What does it do?
Kalau macam in our body, if our glucose dia tinggi, the insulin akan tukar glucose tu jadi glycogen. Macam tu. And then like kalau glucose tu rendah, the glucagon tu akan tukar like the glycogen jadi glucose.
Where does the insulin bind?
Where insulin bind?
Yes. The hormone must go to somewhere, to the cells. So the insulin being secreted into what?
Bloodstream.
Ah, brilliant. Into the bloodstream, and then it will travel to the organs. Where does it go? Where does it go?
different part of body.
For example,
For example,
Liver.
very good. Nasrotu, kenapa bijak sangat? Okay, the liver is the place where it metabolizes, it converts the glucose into energy. Yes? All right, so the insulin can travel and find the glucose molecule because once you eat, once you had your lunch, your glucose level is high. You become hyperglycemic for 30 minutes. So your pancreas start to trigger by secreting the insulin. So insulin will travel to the blood, find the glucose level that is that is high, okay, due to the food that you already consume, and then it will bring this glucose molecule to the liver and store it in the liver. If it's needed, it will be 50% will be converted into energy so that you will feel more energetic. Another 50% perhaps they will store as a energy storage. When you are hungry, when you are depleting of energy, this another reserve of 50% will be used as a source of energy. Okay, and that's how it goes. But if you are low sugar level, hypoglycemic, you don't have enough sugar in the blood, what happens is that pancreas also gets triggered. It will produce glucagon instead. It will start to increase the level of glucose in the blood back to the normal. And that is when you are hypoglycemic, very low sugar. If you are fasting, for example. Okay, all the energies that you're stored in the adipose cells, fat cells, you know that? The glucagon will release it and start to produce a glucose molecule. You need the glucose for you to produce the ATP. You have learned about the gluconeogenesis, glycolysis, glycogenolysis. You have learned about this in your what we call carbohydrate metabolism, if I'm not mistaken. Now, we back to the hypothalamus secreting the TRH. TRH then acts on the anterior pituitary gland to produce TSH. Now, what does the TSH do? What's the function of TSH again?
Trigger thyroid
Trigger thyroid gland to do what?
to secrete thyroid hormone.
Brilliant. Okay, TSH, you can see the word thyroid stimulating hormone. It means it's stimulating the thyroid gland now. Right? So from hypothalamus, it involves the anterior pituitary and then thyroid gland. Right? Okay, so from thyroid gland, it started to produce T3 and T4. And then what does it, what is the role of T3 and T4? And how does it differ? Shikin? Are you okay, Shikin?
Yes, doctor.
Very good. So what is the functions of T3?
To stimulate the nervous system.
Okay, how many functions do they have?
Three.
What are they? You tell me.
Help maintain muscle control, brain function and development, heart and digestive function.
Okay, and in this patient, why is it high? Why does the T3 level is high in this patient? Alia, you want to help Shikin? You
It's
can
high
say no.
because
Yes.
T3 increase the metabolic rate.
T3 increase the metabolic rate. Fakir, how do you agree with Hafiza?
I think T3 indicate overactive thyroid hormone.
What do you say?
I think T3 is indicate that there are too much thyroid hormone.
Fakir, do you have a good rest today? You say you should come first, right, today?
I'm sorry, doctor, because of my line. I using the Mahala line. So
What happened with the Malala? Are you getting married or not?
it's not me getting married, doctor.
Okay. So you're saying that again?
It indicates that there's too much thyroid hormone. T3.
Okay, so that's not the rule. But you're saying about the test. If the T3 test, it means it's too much T3. Yes? But I asked you about the rule. What is the function of the T3?
I think it's like Alia has to. I agree with her.
I still didn't get the answer.
You didn't
Okay,
get
because
it.
there must be some relation. I want you to relate.
Alright.
T3, T4 is almost the same. And how does it, similar? What is the similarities between these two? Why when the T3, yes.
Regulate how the body use energy.
Very good. Okay, acceptable. I want you to relate with the T4. Why when we have the T3 that is high, the T4 also can follow. The T4 most probably will be high too. There must be some, what we call the similarities between these two hormones.
Because T4 will convert to T3.
Brilliant. Okay, so in terms of the synthesis itself, based on the structure, there are similarities. Okay, T3 for somehow, okay, it will be converted to the T4, and some of the T4 also can be, be degraded and become T3 too. So the structure is almost similar, but the role is different. All right, still there are some points that we want to check whether the T3 level is high or low at what condition. Okay, so still we need to have both. We cannot have only T3 test. To confirm that this patient is having hyperthyroidism, these two hormones is compulsory. All right, okay, continue.
And the next one is T3 test. This test measure the level of T3 in our blood. T3 comes in two forms, which is free T3 and bound T3. For the free T3, this form enters our body's tissue where it's needed, while bound T3 attached to protein, which prevent it from entering our body's tissue. If T3 levels are not normal, it can be sign of thyroid disease. T3 tests are frequently ordered with T4 and TSH tests. A T3 test may also be used to monitor treatment for thyroid disease. If our results show high total T3 level or high free T3 levels, it may mean we have hyperthyroidism. Low T3 level may mean we have hypothyroidism, a condition in which our body doesn't make enough thyroid hormone. T3 test results are often compared with T4 and TSH test results to help diagnose thyroid disease. And the last one is T4 test. Thyroxine test is a blood test that help diagnose thyroid condition. There are two forms of T4 in our blood, which is free T4 and bound T4. Free T4 is the active form of thyroxine hormone that enters our tissue where it's needed. And bound T4 is thyroxine that attaches or binds to certain protein which prevent it from entering our tissue. T4 level can be measured with either a free T4 test or a total T4 test. A free T4 test directly measures the amount of free T4 in our blood. Medical experts believe this test provides more accurate information than a total T4 test, so it used more often. A total T4 test measures free and bound T4 together. A calculation may be done to figure out how much T4 is free. This is a less accurate way to check how well your thyroid is working. In general, T4 results that are higher than normal may be a sign of hyperthyroidism. Next, I want to pass to Atika.
Okay, so you can see from the word itself, it's lots of iodine, right? Iodine, T3, okay, thyroxine also, a structure is similar with the iodine. Okay, so the T3 is the active form of the thyroid hormones. The T4 usually is inactive form. So most of the time you will see that these T3 are highly expressed, or they are very high level, because they have functions to tell you whether you are having an excessive amount of this hormone or not. Okay, so you can see that if this is the condition, if this patient is having hyperthyroidism, it means that the thyroid glands cannot regulate the normal balance of these hormones anymore, right? So you say that the T3 functions to regulate the how the body uses the energy, right? So this patient, she could not, last time we mentioned about she have like a disturbed mood, she cannot concentrate, lethargic, very weak. You remember about the symptoms? This is because of this high amount of 3-iodothyronine and also thyroxine in the blood. Okay, so it changes how the body uses energy. Right, everything is not right now, it's excessive. So it's not in the normal balance as well. So that's why some patients, they are having lots of energy at night. They cannot sleep. They try to sleep, but actually the body is working very hard due to the high T3 and T4 level. That's what we've seen in this patient, okay? All right, move on to the next slide.
There is two tests that we can that help us to find why thyroid is overactive, which is radio iodine scan and uptake scan, and thyroid ultrasound test. Okay, radio iodine scan and uptake test. For this test, you take a small dose of radioactive iodine called as radioiodine to see how much of it collects in your thyroid gland and where it collects in the gland. If your thyroid gland take in a high amount of radioiodine, that means your thyroid gland is making too much thyroid hormone. The most likely cause is either grave disease or overactive thyroid nodules. For thyroid ultrasound, the test this test use high frequency sound wave to make image of the thyroid. Ultrasound may be better at finding thyroid nodules than other tests.
And you mentioned about the radioactive. Is it safe to the patient? Anyone?
Yes.
Why do you say yes? If I got hyperthyroidism, I will not take the radioactive. It will blow up my thyroid.
Just take a small dose of radioactive iodine.
Even
Maybe
small
it's
dose,
safe.
maybe. What is this? You're killing yourself, becoming a zombie or what? Why is it? Is it still be implemented in the clinic now? Hello? Is it safe? Is radioactive is radio means radioactive, right? So it means that the iodine, they tag or they change the structure to hold the radioactive. And why do they use this radioactive in the medical imaging? Why? What's the purpose?
I think it's safe but need lifelong treatment.
Okay, how safe is that safe? It's not only for this one, but in some other treatment also, like the breast cancer patient, they used to have this nuclear imaging also. They ask the patient or they inject a certain radioactive elements into the blood for the tracking purpose. So the same goes like here. You use this radioactive that is tagged, tag. They tag it with iodine because you know that in the thyroid there are lots of iodine, and T4 and T3 made up of iodine. So they tag these radioactive elements to go to the thyroid gland, and this radioactive was designed in order to bind the T3 and T4 in the thyroid gland. Okay, so you inject the radioactive elements, it will traverse into the blood, and they will go directly into the thyroid gland. And if the patient is having hyperthyroidism, you can see lots of glitter, lots of colors or bright colors, fluorescence in that thyroid or neck area. And that can also be a type of diagnosis to say that, yes, the patient is having hyperthyroidism. Okay, so you can compare between, the brightness of the colors or the light emitting from that radioactive. But as you said, yes, the dose is really important here. There are safe dose that is allowed for the medical purposes, but of course it should be eliminated after some time. There must be some protocol. All right. For example, the patient is not allowed to have another set of radioiodine scan for 6 months. This is to reduce the amount of radioactive in the body, so they can be eliminated by time. All right, so there are safe dose that is allowed in the clinic, but not too much. Enough just to diagnose whether this patient is having hyperthyroidism or not. All right. Other test is the thyroid ultrasound. You know about the ultrasound. They are using the sound wave, like the baby. You know the baby. You will have baby soon, right? If you like the first trimester or maybe one day or maybe 2 weeks or 3 weeks, you can see the little tiny human being in your uterus. Okay, you same method, scanning, but not emitting any lights like the radioactive. Mostly radioactive, they are giving the lights. You can see the lights. COVID-19, if you got any chest x-ray, for example, you can see also complications that is happening to your pulmonary system. All right. So ultrasound, x-ray, radio iodine scan also can be used to diagnose the hypothyroidism, which is good. I hope you know about this. Okay. And the three one you say blood test, that's include the testing for the TSH, T4, T3, and some of them in a free form, some of them in the binded or bounded form. Okay, the free one is free to travel anywhere they want. The bounded one is restricted to one specific location only, but they are still the T4 molecules. Okay, move on to the next slide. 1 hour from one slide.
Okay, next is pathophysiology of hypothyroidism. Basically, hypothyroidism is characterized by lost normal regulatory control of thyroid hormone secretion. Then the action of thyroid hormone on the body is stimulatory, which result in hypermetabolism and increased sympathetic nervous system activity. And there is alteration secretion and metabolism of hypothalamic pituitary and gonadal hormone, which secrete many excessive amount of thyroid hormone. Then the excessive amount of thyroid hormone will stimulate the cardiac system and will increase the adrenergic receptor. Due to that, our body will experience tachycardia, and there will have increase in cardiac output, stroke volume, and peripheral blood flow. And negative nitrogenous balance, lipid depletion, and the resultant state of nutritional deficiency will happen, and then the hypothyroidism disease will occur.
You want question? Move on, yes.
Okay. There are several treatments available for hypothyroidism. First, symptomatic treatment. The best drug that acts as the first line to treat symptoms of hypothyroidism is beta blocker, which is propranolol. Propranolol are used to block beta receptor in the peripheral tissue innervated by the sympathetic nervous system. This could reduce rapid heart rate, sweating, hyperactivity, anxiety, and tremors.
Why are you targeting the heart? Camelia, why do you target the heart? You should target the thyroid gland, right?
Yes, but it has to function.
What is the function?
Yeah. Second, it will decrease the conversion of T4 to the T3. So it can form T3 and can exit metabolic effect within the cell and can increase the metabolism. After we give patient propranolol, we got to give them anti-thyroid medication. There are propylthiouracil and metimazole. This medicine gradually reduces the symptom of hyperthyroidism by preventing thyroid gland from producing excess amount of hormone. Propylthiouracil is only available in 50 milligram unit, while metimazole is available in 5 and 10 milligram. So how does propylthiouracil work? Propylthiouracil inhibit the thyroid peroxidase. If it inhibit thyroid peroxidase, it causes less conversion of thyroglobulin and less conversion of iodine into the iodinated thyroglobulin. It takes less iodinated thyroglobulin back to the follicular cell. Lepas tu, So it will lead to decrease in T3 and T4. And second, methylmazole does not perform like how apa tadi? Propyltyrosine. Methylmazole perform same function as propranolol, which inhibit T3 to T4 conversion. If there less T3, then that means less activation on the genes to make protein that increase metabolism and psych- psych- physiological activity. Symptoms usually begin to improve within 6 to 12 months, but treatment will with anti-thyroid medicine typically last 12 to 18 months. After that, the dose may be slowly decreased or stop if symptoms go away and if blood test results show that thyroid hormone level have returned to the standard range. That's all.
My question is, why do you give the beta blockers?
Beta blockers.
The anti-thyroid makes sense because it stops the thyroid gland producing more thyroid hormones, means you are blocking them from making more and more T3 and T4, right? So anti-thyroid means you against the activity of the thyroid that produce more. So now you want to maintain a good balance of T3 and T4. That makes sense. But why? What is it to do with the heart? Why do you give the beta blockers to?
What I know, beta blocker pun boleh stopkan conversion daripada T3 to T4 tu.
Yes? Huda? Huda seems not agree with that. Do you agree with that?
Yes.
Why do you agree?
Because beta blocker can stop the hormone.
Can stop the production of
hormone
of T3 and T4. Okay, next question is, are we taking these two at the same time? Anti-thyroid and beta blockers? Which one is the first one? Yes.
Beta blocker.
Beta blockers first? Is that the first line?
Yes, beta blockers is the first line.
So you go for beta blockers first, and if it does not doing the job, then you go to the anti-thyroid.
Yes, that.
If the anti-thyroid is not working too, then
Proceed to the other treatment.
no more treatment because she already died.
No,
Okay.
doctor.
So you have to do the surgery. Instead, this is just a medication, right? If it's not resolved, so you have to cut it. The portion that is enlarged, that producing lots of T3 and T4. So you just do some incision. You take out or you remove a portion of the thyroid gland. So by that way, it can reduce almost half of the T3 and T4, okay? But of course, we start with a medication like this. It makes sense because beta blockers also can stop the conversion of the non-active T3 to the active T3. So it will back to the normal level. You mentioned about the methimazole also act as a almost similar in a similar way like a propranolol. Okay, very good. And you should put it here a surgery too, because this is also one way that we can treat. Right? If you want.
After this.
After this, okay, I'm too fast. Okay, you go to the next slide.
Okay, Assalamualaikum warahmatullahi wabarakatuh. So the next slide ni lah yang about the surgery. Tada. Okay, so the first treatment is thyroidectomy, which is basically it's like the surgical, the removal macam all ataupun like some part of your thyroid gland. Okay, so thyroidectomy ni dia macam it is like an option kalau we have like some problems dengan anti-thyroid drugs yang tadi Milia sebut tu, ataupun macam dengan radioaktif pun dia tak boleh, radioaktif yang kanan ni, yang tu. So like it's basically like macam like the last option lah, the last treatment macam tu. Okay, so tapi dia ada side effect juga untuk thyroidectomy ni. So after your thyroidectomy ni, you may have like temporary sore throat, neck pain, difficulty swallowing, ataupun macam akan ada weak voice. And then like your diet pun akan jadi restricted daripada evening sampai surgery tu. Dia ada jugalah side effect dia. And then like the kanan one is radioactive iodine ataupun RAI. So it's basically like a treatment for overactive thyroid. Macam hypothyroidism lah, dia sangat sesuai. Cancer pun boleh guna yang ni juga kalau ada cancer thyroid. So the term radioactive kan dia macam, radioactive kan macam frightening kan, tapi sebenarnya dia safe je. So they generally well tolerated and reliable treatment that targets thyroid cells. So there's little exposure to the rest of your body cells. So radioactive iodine therapy ni is like, dia macam common use kalau hypothyroidism lah. Biasanya orang akan guna yang radioaktif ni lah biasanya. So dia macam, there's also like
English.
Okay, sorry. Okay, one more. So it is also like more reliable cure for hypothyroidism than anti-thyroid medication. Like macam
English.
Shh, diam. Okay, mana tadi? Because like unlike this drug, radioactive iodine is permanent. The drug is not permanent, but the radioactive iodine ni it's permanent. So radioactive iodine therapy can destroy either all or like part of your thyroid gland. It's like the same with the thyroidectomy surgery. So in this case, it is not necessary to have the entire thyroid gland non-functional. Macam ni macam, salah, term Melayu. Sorry. Like in this case, like you can move like parts or all of your thyroid gland. Macam tu lah.
Okay, English. Next. Very good. Okay.
Next is for management of hypothyroidism. The first one is monitor vital signs, especially heart rate and blood pressure. Both increase in hypothyroidism. Second is ask if the patient has chest pain due to increased heart work. Next is obtain ECG. Atrial arrhythmias may occur in hypothyroidism. ECG is electrocardiogram, which is measure electrical activity of the heart to detect cardiac problems. Next is teach the patient to relax. Administer medication as prescribed, such as beta blockers. Monitor the patient's weight daily. Administer anti-thyroid medication as prescribed. Provide oxygen if the saturation is less than 94.
English.
Cek. Peratus apa bahasa Inggeris? 94%. Okay, next is if the patient has a fever, provide a cooling blanket. Blanket. And the last one is check thyroid function labs. Okay, thank you.
You're welcome. So about the teach the patient to relax. How do you teach them?
Teach them how to when they feel stressed or like rasa susah hati, we teach them how to tarik nafas betul-betul. Bukan. How to breathe in a right way. Like that.
Right way or left way? Probably how do you teach the patient to relax? Anyone? Tell me. Imagine I'm the patient.
I would say make sure the patient is in a comfortable positions, and ask them to put one hand to your chest and the other on your stomach, and ask them to take a slow and regular breath, which is breath, which is breath through your nose, not using your mouth, because sometimes if you have like, how do you say, asthma or something like that, if you have difficulty in breathing, we usually breathe with our mouth, like so we have to breathe through our nose and repeating it until we feel calm. Twice a day, maybe, like something like that. And make sure to do it regularly, like maybe setting it twice a day or 3 times a day, in like 5 to 10 minutes, you do that breathing.
Okay, next. Very good.
Okay, for the prevention, hyperthyroidism is not preventable, but you may avoid the symptom of hypothyroidism by being diagnosed and treated early. Second, avoiding caffeine and reduced stress may help relieve symptoms of anxiety, nervousness, poor concentration, and fast heartbeat. Next, attend all your doctor appointments. Advise to take anti-thyroid medication at the same time each day. Eat healthy and nutritious diet with necessary amount of iodine, calcium, and sodium. Exercise regularly and learn relaxation techniques such as yoga and deep breathing.
Chola is not taken as a relaxation technique or yoga. You try yoga before? Do you think you can be relaxed if you do yoga?
Yes.
How do you do yoga? You never know about this, right? You never try. There is Tai Chi. Yoga is a different thing. You know, you have to be rational. You know about yoga, right? How do you do yoga?
Based on my experience and knowing, when you are doing the yoga, the stretching, you have the breathing, the way of breathing, so it can make you relax if you do it properly, I think.
Okay, so you know it's quite difficult to say this is wrong, but you know the patient is having the thyroid problem, right? So if you say, okay, now look up, but at the same time you know that the neck is not well, right? So that is the area that is affected. You know, there's a problem with the, or maybe but swollen area at the neck area. So you still like yoga means if it's involved the head, then maybe not. Okay, but some other parts, maybe legs or hand or your arm, is better. So if you got another or other option that is more suitable, so go for that before you choose yoga. I think deep breathing can be done without yoga. Maybe if she's Muslim, then you can ask her to pray, which is better because pray can be of different position. This is option for a Muslim. But try to avoid affecting or moving the neck area. Okay, very good. I hope she can relax after your advice.
Alright, for Islamic perspective, like what you just said, Doctor, maybe prayer is one of the things that we can do, because prayer is not like just we talk to Allah about our diseases, and it also can help us to become relaxed and more calm. And it can become one of our way of exercise to maintain our healthy body, because we are moving, because we are not doing static, because we are doing many type of moving, because we are ruku' and we do sujud and so on. So another from that, after we pray, maybe we can do zikir and zikir and reading the Quran. And then we can also like doa to Allah. This is one of the doa that we can use, which is Bismillahirrahmanirrahim. Allahumma afini fi badani, Allahumma afini fi sam'i, Allahumma afini fi basari, la ilaha illa anta. And we can if we say to Allah, Allah grant me a health in my body, Allah grant me a good hearing, Allah grant me a good eyesight. There is no God worthy of being worshipped except you. That's one of many ways we can view this. That's all.
What is this? Huh?
Yes.
Doa?
Yeah. One of the things that we can do. Yes, this is a doa.
And if someone asks you, does practicing this doa can heal?
It's not like you can hear, but we
Why not? You don't believe in Allah?
No, we have because we
Why?
doa to Allah, because we know Allah will hear our prayer. So it's not like we pray when we are sick. We pray before we sick, if we sick, and after we sick. We have to pray continuously. But as a human, basically we will pray more when we are in like a difficult situation, like if we have any diseases or any nasib buruk in that situation.
You pray more when you're sick?
It's not like, yeah, we pray continuously, but when we are sick, we will try to pray more and keep ourselves closer to Allah. Because basically people, if people have any diseases, they usually will think maybe they will die, maybe they will meet Allah. So they want to do more what we say, amal ibadah.
So this is gonna be the first one or the last one? The dua.
In what aspect? If after prayer, in last thing we do. But if in our daily life, like continuously, we will like doa in our scenario.
Yes. So the dua actually is the first thing that you want to do, not only when you are sick, but every day. So this is gonna be routine. You know the Maksurat? You read the Maksurat?
Yes.
When?
After subuh and after asar.
Every day?
I try to do it every day.
Or you try? When is the last time you try?
last week before.
Make sure you practice this one because this is very important. The doa, the al-maqsurat is the compilation of the al-ma'thur ataupun what do we call it as the sahih, the compilation of all the selected prayers that is based on the hadith that is authentic. So this is also a dua from the Prophet. So if you want to practice this every time when you reciting, or if you're not reciting the maqsurat, that's fine. But you can recite it in your dua after your prayers. Means that give health in your body, good hearing, good eyesight, and there is no God worthy of worship except Allah. Right? Okay, so I hope you can practice this and you want to, educate your patient with dua. And this is very rarely we can find that nurses, because nurses in the hospital, they are almost reluctant. I can say that even it's a Sharia compliant hospital, but it's only the system. But this is left within the individual. If the nurses herself or the himself well equipped with this Islamic knowledge, it's better. If you find that there's a Muslim there, then you can just slowly advise and then give this, because the Prophet said that if you give or deliver one word or one single word from him, then you're gonna enter paradise. All right, so you keep spreading all these words, all the dua, not only for your own benefit but also for other people's. They might be really appreciate you if you can just tell them about this. But the thing is, our culture is that if you try to advise people, then people will say that yes, Ustazah, something like that. Right? So make sure you know who is your target patient. Not all patients are similar. Just like you here, we have like 9 different characters. So same goes with your patients later on. You will have like fuzzy patient, you have like very patient patient, you have like very outspoken and open-minded patient, you have close-minded and very restricted version of patient, right? Lots of anger, lots of emotionals. So you have to maintain your adversity quotient or your emotional intelligence in handling the situation. In the case of emergency, in the case of urgency, you have to make yourself stable before you be able to treat them. So make sure you yourself are in a good condition. If you are affected emotionally by what the patient are saying, then you are very weak. I'm telling you, this is based on this true story, okay? So make sure you equip yourself emotionally stable. Don't easily get offended by the words of the patients because they know nothing, because they are sick. When you are sick as well, so your emotional also gets affected. But don't let yourself, when you are treating the patient, don't let yourself in the same boat with them. You have to guide them. You have to control yourself so that you can control them. Don't let them don't let them underestimate you and also doing something bad to you. Don't easily get annoyed or offended or whatsoever. All right, it means that if you get emotionally unstable after what they have said to you, then you are weak. I want you to be strong. As a nurse, you are not, Assalamualaikum. Yes, you have to do like that, because to be polite and to be kind is one of our core business. But at the same time, you have to be strong from the inner side. Okay, you should not get annoyed by all these patients, because you will face more than thousands different behavior. So just keep calm, just relax, take a deep breath. If you cannot handle the patient, be it so you go and ask for help, or you go take a fresh air and ask someone to handle the case if you are not be able to. Don't let your work or your job affecting you so much. Yeah, it's just a job. It's just a little human being. So don't let all these patients overcome you, try to annoy you, try to distract you from what a noble job that you are currently doing and what you'll be doing soon in the future. Okay. All right. So thank you very much, everyone. I can see that lots of improvement in my group. If you compare from the first session, I think you are a bit reserved and a bit shy. But up to this point, I think you have improved a lot. And I think in the next semester, maybe you also will improve more. I think you have more PBL sessions to come. In a PBL session, that is where you can express your thought. You can challenge yourself, not myself. Okay, I'm not challenging you. You are challenging yourself to give a good answers. You're challenging yourself to unmute and to speak out. You are challenging yourself to be confident with your answers. All right, even though it's from a Google, from any other sources, but you are confident with what you are saying, and you are not afraid with all the question that I'm asking. If I ask your name and then you start to become, sudahlah, takutnya. All right. So next time, if someone come to you or the patient come to you, try to distract you so you are not easily distracted. Okay. I hope you can handle and you can keep on improving yourself as a future nurse. You're not seeing me next semester because I'm leaving to Netherlands for next month. I will continue my study. So I got another offer there for postdoc in physiology. So I hope you can pray for me. So I'll be there 2 or 3 years. I hope I can join maybe after you graduated, then I can see you again. Good, everyone. I see you later. I'm not sure whether because I'm in KL now, I'm preparing. So going to the embassy and also Ministry of Foreign Affairs for the documentation purposes. Plus I'm not, so I have to